More than 100 million Americans suffer with chronic pain. The cost that generated is more than $500 million per year. So my name is Alex Da Silva. I'm the director of Headache and Orofacial Pain Effort Lab, HOPE Lab at the University of Michigan School of Dentistry. Here at the HOPE Lab, our main goal is to develop technologies for pain research, education, and treatment. Why that? I'm a dentist, and one of the main things that are always involved with pain. There's always a frustration, not with acute pain, because that we can address, but with chronic pain. So one of the first problems that we have to resolve is the way that we express our pain. So patients have problems to describe the severity of their pain. Remember, you can have a pain with migraine and some patients with fibromyalgia, but you have to provide one number, from 0 to 10, give me a number. So how to address that? So we create the pain tracker technology, mobile technology, where the patient intuitively put it in precisely put information, not only the severity of the pain, but the location of the pain. And that's one of the also goals of the MCARP, is that we use technology so that the patient can show their pain and how that is being affected by treatment on medications or procedures from multiple doctors, and track that in a much more precise way. Breathing was one thing that has been always used in cognitive behavioral therapy, but not for all the patients, because it's very hard for them to imagine in a calm and relaxed environment before a procedure.
So the Oculus Rift is a virtual reality head-mounted display that basically puts screens in front of your eyes and blocks the surrounding environment. And a computer then feeds those screens with whatever content the creator wants.
One of the technologies that we are testing now is virtual reality briefing, where the patient can use the breathe in and breathe out, but much more immersive way, where they see the lungs in 3D. It's completely synchronized with them. So there are several technologies that that can help with not only for us to better understand pain and how patients respond to pain, but there are also new technologies, especially for neuroscience, where we can go straight to the brain.
The Hololens is an augmented reality device. It allows you to add computer graphics or digital models to what you're seeing in the real world. So you can actually have digital content there with you wherever you happen to be.
We put a cap on the head of the patient, and those sensors and so get all the information of the brain during the pain or clinical procedure. As soon as we see the brain model with the activation related to the procedure in real time, we can plot that brain in the patient's head, and we talk, and as the patient moves, the brain moves with the patient. We can also pick the brain and move it to different areas of your visual field. So there are many things that you can interact, not only better with the patient, but also with the information that is provided by the HoloLens. With the development of new technologies, we be able not only to access the brain and be much more precise about that, we can optimize the way that we interact with the patients.